Hi, I'm Tal with MotionGuidance, and right now we're going to look at some of the ways the MotionGuidance visual feedback system can enhance your rehab, both training, assessment, and results. More looking at the balance and vestibular aspects of rehab. We're going to be using the MotionGuidance motion maze here with the clock on the outside and the maze in the center, along with some of our other custom tracking grids. So let's take a look at how you can use this in both balance and vestibular rehab. All right, the first couple we're going to look at are clocks as a therapy drill, as well as the motion maze for motor control. So for the clocks drill, you wear the strap on your head, you have the client look at the center dot, and then you align the laser where they're looking at the center dot, just to standardize that. And then you can quickly go from the red target to the number and back. So the first instruction is usually just to go around the clock, going from the number to center target each time. So we're going to go 12, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. They can do this clockwise and counterclockwise, and also have the goal of quickly locating the target and quickly getting back to center while being accurate. For general motor control, we can do our motion maze. So again, having them look at the center dot, aligning the laser right where they're looking, starting at the beginning of the maze, and trying to accurately track the laser through the maze. And this maze will go through all 4 quadrants of motion. If you're closer to the flag, you're going to go through more neck range of motion to achieve the goal. The further you are, the more difficult it becomes to be accurate, but you are moving your head less, so that might apply to different patients in rehab. Another way we can look at cervical motor control is using our butterfly tracking grid, which offers some of the more diagonal, smooth patterns that you can use to test and train cervical motor control. I'm going to demonstrate this in sitting, but you can do this in single leg stance, tandem stance, standing on a foam pad, reaching, doing it interactively while catching a ball. You can add layers of challenge to this exercise. And that's important to know when you want to progress your patients and see how they interact in a still environment or something a little more cognitively challenging or task challenging. So let's look at this in sitting. I'm going to put the laser on. I'm going to have them stare at the center target, standardize the head and the laser together, and then go through some of these little butterflies here. We can do the small butterfly, medium, and large. You might find that one quadrant in particular is really challenging, and they can't work in an upper right quadrant or a lower left quadrant. This will cue you to practice in that domain. Another thing to note here is the closer I am to the flag, the more range of motion is required to track that. So if you're really trying to dial in on a specific motion, you might want to get a little closer. If you move further, this might be better for someone with less range of motion, or maybe they have pain in a certain quadrant and they just can't rotate their head very far. So you can move back and kind of get to the edge of what they can handle without pain or handling good control and work on that motion. You can also do more sweeping type motions with our figure 8. So those are all options you can use when addressing cervical motor control. Next, we're going to look at head trunk dissociation. So with the laser on the head, patient looks center target, aim the laser at the center target, arms crossed, and rotating the trunk underneath a fixed head. So this is assessing both cervical range of motion, but also the ability to dissociate motion between your neck and trunk. Another posture and pelvic mobility type exercise you can use the MotionGuidance would be around the trunk. There's a couple options for this. I typically put it right on the side of the hip and aim the laser out, especially if the client has a bigger stomach. But you can use it in either place, just whatever's working best for the patient. So let's take a look at this one. I'll use it on the side of my hip for demo purposes. We're going to stand here, just turn on the laser, and let's just aim it right at the center to start with. So this is going to be used to cue the patient on lumbo-pelvic mobility. So with their arms crossed, you can see at first if they can have enough motor control to make the laser go up and down by moving only through their pelvis. As they see the laser move, you can cue them to move it up further and lower, further up and lower down. And you can just be watching for how much they're moving the rest of their body. The goal of this one is to isolate motion at the lumbo-pelvic area. But that's a really good and simple cue to get people to start learning options to how they can move their body in standing with some direct visual feedback. The lumbo-pelvic area can also be used for something like lumbo-pelvic rotation. Again, centered up, across the arms, and rotating left and right. You might use this if someone has a deficit in one direction, standing straight on with the flag, or just working on their general motor control ability to rotate their lumbar area under a fixed upper half. Another way you can use the thorax or trunk mounted laser is looking at things like kyphosis or posture type exercises. So this might come in handy with an elderly patient whose posture is here, and we're working on endurance, trying to just simply stand up straight. You can always add exercises, band pulls, and things like that to make it more challenging. So let's take a look at that one. I'm going to turn on the laser, center it up, and then you can see if I'm moving into thoracic kyphosis, I'm going to be dropping down there towards that 6. Simply cue the patient to elevate the laser and hold it there. From there they can work on different things, reaching, perhaps some band pulling, catching a ball, whatever you feel like would be necessary for the patient. And back down. Coming up. You can also give them some tactile cues, and then once you get them where you want them, you can even re-aim the laser centered and say, hey, just keep that laser centered there. And reach to the 3, and the 9, and the 2. And as they start to lose that posture, you'll see the laser drop back down. So that can be a really good cue just for simple posture exercises with your clients. So simple balance techniques are really easy to add a visual component to that both challenges the patient but also gives them direct feedback to their stability during the exercise. So let's take a look at some of the options. So first we're just going to stand, stare at the center target, and aim the laser at the center. And then we can do some things like reaching left and right, up and down. Just see what the head does during this. We can also stand in a more narrow base of support, so tandem stance. Again, adding some reaching. You can visualize if the person has to quickly move their head in a different direction. You can stand on one foot. Again, adding some reaching, some band pulling. Or you can also use things like a Dynadisc or foam pad to add extra challenge. So each time you're going to get a visual on where the body part is moving as they're doing the exercise. This can also be done around the trunk, waist, chest, wherever you want to put the laser for visual feedback. Another cool application you can use is testing someone's ability to be gaze forward, head up, and doing a task like stepping. In this one, we're going to use a standard step stool. You can place it about 5 feet from the flag. And then just mount the laser. Have them stand, stare at the center target, center it at the red dot, and then perform step-ups while trying to keep their head looking forward. You can time them for a minute and also visualize how much deviation they have when moving their head and how able they are to keep their gaze forward as they're doing the stepping task. Depending on patient need, you could also use some of our other body straps, such as the shoulder or arm strap, to work on different exercises that incorporate both balance and different targeting using their upper extremities. So in this one, for instance, you could have them stand on one leg, raise their arm, turn on the laser, center it up, and have them dialing out different numbers to throw their center of balance off with their arm motions. You could also use things like a foam surface or a Dynadisc for that. This is obviously a good exercise also for shoulder range of motion. And the nice thing about the adaptive ball and socket system is you can set the range that you want them to be in. So for instance, if this is their maximal range of motion, you can then turn on the laser and bring it to the center and have them try to get back to that target each time. And if they're getting higher, then they're making progress. So those are just some little ways you can tailor the exercise to the patient based on their available range of motion. Here's a look at the chest-mounted strap that you can use when doing any balance exercise. Simply slide the mount into the pocket, turn on the laser, aim the laser at center target, and then you can perform your balance progressions from narrow stance, tandem stance, single leg stance, and also things like standing on foam and other uneven surfaces. Let's take a look at that. You can make these more dynamic by having them aim their head at different numbers, reach towards different numbers. You can call out the numbers for your client to interact with during the exercise drill. Range of motion testing is another way you can make something simple, like turning your head and evaluating how well you can do that, into something more interactive that gives the patient real-time feedback to where their deficit is. So let's take a look at the neck, for example. You can apply these principles to any body part. Putting on the head strap, you can have someone centered at the flag. I'm just sitting on a rolling stool. Let's have them look at the center, and let's calibrate that to the center by aiming the laser right where they're looking, and just turning their head left and right. Now this is obviously going to track well beyond the flag here, but even in this position, you could pick a little target and put a sticky pad on a wall, and just hold their trunk still and visualize if they're limited in one direction but not the other. Let's say in this case, a patient was limited in rotation left. On a rolling stool or in standing, I could have them aimed with the seat a little bit to the right and then trying to rotate left to get to a number, let's say the 3. Let's now go beyond the 3. Let's see if we can really push it and get further and further each time. If you want to kind of test their max and then see if they can get past that, a good way might be with a chair, have them rotate fully in one direction. Let's say that's all they can get. I can then come in and bring this laser all the way to the center and then bring them out of that. So now they're really just trying to get to the center or beyond. The only cue you have to be careful with here is just making sure the client isn't rotating their torso. You can simply hold their shoulders lightly or just give them a cue to keep the rest of their body still. So again, you can apply that to any direction in terms of rotation, right, left, up, down. You can use different numbers and targets to make this more interactive with your clients. Visualizing cervical retraction is also another great, simple, but really effective application using motion guidance. So for this one, you're going to be using the perpendicular mount, wearing it on the head. Again, have the patient seated, looking at the red dot, and then bring the laser to the red dot to standardize it. Now the cue for this one is simply to move the head backwards without moving the laser. So you'll notice if I just go into upper cervical extension or flexion, that laser is going to move. If I can go into pure retraction, I should be able to keep that laser nice and centered as I'm going through that motion. So anytime they lose it and start to get in a different motion of the neck, they're going to be instantly cued. That allows them to really try to find the end range of their motion and visualize where they might be cheating with their motions of their upper neck. One of the more researched areas that uses visual feedback from a laser pointer in rehab is looking at joint positional awareness testing or joint positional error. This can be used on the head, on the shoulder, on the trunk, kind of anywhere you want. The concept is really simple. It's just seeing if using your own proprioception, if you have the skill to know where your body is in space. And the way to test that skill is using a visual marker. So let's look at an example for the head. You notice on our flag it says center target calibrated for joint positional awareness testing at a distance of 5 feet. So all that means is 5 feet back from that center target is where research has indicated joint positional error outside of that center target. So it's nice to put like a sticky pad or a line of tape on the floor about 5 feet from your target, just so you have that there ready for you to practice with your patients with. So for the head, you can have someone sitting about 5 feet from target, looking straight ahead. Remember, you have them look at the red dot, and then you can adjust the laser, and that's going to calibrate the head and the laser together. And we'll start with rotation right. Just have them fully rotate to the right and back 3 to 6 times. And then to test this, you're actually going to have them close their eyes. They're taking out vision, turn to the right, come back to where they think they are, and recalibrate. Close eyes, turn the head away, come back to where they think they started, open their eyes, recalibrate. Let's take a look at someone being way out of position. They close their eyes, turn their head, come back, open, and they're outside of this target. That would represent a poor return to target. If they do these consecutively, whether it's random or always in the same space out of the target, that would represent some source of misinformation or poor accuracy proprioceptively. So obviously you can look at this going in different directions. Rotating right, you can also look up, down. You can use numbers on the clock if you want. You can be creative with that. But that's another way to test and train joint positional awareness in clinic. All right, so another neuro application using motion guidance would be looking at saccades. This is essentially the ability of a person to dart their eyes in different directions, locate objects without moving their head. And this will show up because we've got a visual pointer affixed to the head. So as you see their eyes move, you'll also be assessing the ability of how still they can keep their head during the eye tracking. So the clock here is great for that because we have lots of different targets and directions you can challenge the person to dart their gaze. So let's take a look at how this might look. I've got the head strap. I'm just seated on a stool here. Get an upright posture going on and aim the laser to the center target with them looking at the center target. And then instruct them to look between 3 and 9. 3 and 9. 3 and 9. 10 times. Often what you'll see with a deficit is a head motion to the direction they're looking in the area of the deficit. So if I'm looking to the 3, you might see it tick to the 3, but stay still when looking at the 9. You can also do these at various angles. So looking from the 1 to the 7, up to the 1, down to the 7, up to the 1, down to the 7, up to the 1, down to the 7. The laser is going to show you if every time they look to the 1, if they're moving their head or not. So this is just assessing that skill, and of course you can use that then to train that skill. You can also test saccades in different various neck positions. So you could be doing this in rotation left and darting the eyes left and right. You could be in rotation right and darting the eyes left and right, up and down, or any direction you choose. So another thing we're going to look at is called smooth pursuit, which is simply your ability to track your eyes in different moving patterns while keeping your head still. And what we're trying to minimize here is your head drifting towards a certain direction as you attempt to track your eyes. And so here's one where you can use our butterfly tracking grid because it offers some of those different directional patterns that the client can look in. So what you're going to do here is, in a seated position or standing, putting on the laser, assuming an upright position, aim the laser where they're looking straight ahead. The goal here is to look and trace your eyes on these butterfly grids without moving the laser. So I'm just following the lines of the butterfly, clockwise and counterclockwise. You can cue them to look at certain dots left and right, or to follow different lines. But what you're going to be looking at during this exercise is if their head is drifting towards a certain direction when they try to track their eyes in that direction. The object here is to keep the head as still as possible. So that's going to be an assessment and also a way you can train that through exercise. All right, let's go through some exercises that include VOR, or vestibular reflex training, and gaze stability. These can be progressed in lots of different ways to add more challenge by altering the environment, the speed, and the challenge of what you're trying to have someone do when moving their head and stabilizing their gaze, or moving their gaze in opposite directions of their head. So let's take a look at some of these things and talk through how you could advance them with your client using the MotionGuidance system. So we're going to use the head cradle, and we're just going to start in an upright position. I'm going to mount this on my head, and to standardize the head and laser together, we're going to have them look at the center target and aim that laser right where they're looking at the center target. So this now represents straight ahead on my visual field at the target. So let's first start with what we call ×1 viewing, which would just be me keeping my head rotating back and forth like saying no while staring straight ahead at the red dot. So for this one, if you're the clinician, you would want to be standing here in the corner, looking at their eyes, and seeing if they're maintaining gaze fixation on that center target. If you have a metronome, they could be going to a beat. You could do this for 10 seconds at a time in bouts of 5 or 10, depending on what kind of symptoms are elicited while doing the exercise. Commonly, you'll feel dizzy or nauseous if you do have a vestibular problem. Eliciting some of those symptoms is okay, but the goal is obviously to keep someone comfortable and that through practice they can achieve the same task without eliciting symptoms. Let's look at something a little more complex. This would be moving the head in the opposite direction of where the eyes are moving. So this takes a little bit of a verbal cue for the patient to understand what they need to do. But essentially you're going to be moving the laser to the 3 as you track your eyes to the 9. So if my finger here is my eyes, it should look like this. And you're going to be going back and forth. So we're going to go 3 while looking at the 9, and then we're going to go to the 9 while looking at the 3. 3 while looking at the 9, 9 while looking at the 3. So my vision here is actually moving in the opposite direction of the laser. This is going to be much more challenging. So the same rules apply in monitoring their symptoms of dizziness, discomfort, nausea, whatever symptoms are elicited. In terms of progressions, there are lots of ways to make this more challenging as they become more successful. One would simply be in standing, and then standing on an unstable surface, walking forward and backward, moving around, or having an environment that's more complex with things going on behind them. This would be something like people getting symptoms from shopping at a supermarket or something like that. Of course, we'll be doing different angles, so upward, downward, diagonals, in different positions as appropriate for your client. Another great balance in vestibular type exercise is called the butterfly walk. And you can modify this and get creative with this, but essentially walking in different directions in kind of a figure 8 while maintaining a fixed visual. So I'm going to demonstrate that for you really quick. In standing, we can put on the head strap, have them look at any target. Let's use the center target. So I'm looking at the center target. I'm going to aim this here, and then I'm going to walk around the room in different ways while trying to keep that laser on center target the whole time. So I could add different things for the person to walk around, different cones, but the point is to try to have them moving around in a figure 8 pattern while keeping their head still. Another way you can challenge this with certain athletes or clients is going to be more sport specific. So maybe they're catching a ball left and right while keeping their head on target the whole time. You could also have them standing and shuffling back and forth, keeping their head centered on target. Those are all ways that you can advance and kind of tailor the exercises based on what your client is needing